Hey, good afternoon and welcome to another edition of Health Sense right here on 1FM 91.3, supported by Glen Eagles Hospital. Now, the theme for today is Oh Man, where we talk about manly issues. Now, we're dispensing important health advice for viewers who are thinking of running the Standard Chartered Marathon, and we'll also discuss the Movember movement, which is also very, very important for men all over the world.
Remembering that we are getting into the height of our marathon season, there are going to be a lot of races happening, and I think a lot of people want to know just exactly how they can prepare for it, what they need to know about it, and there are one or two manly issues perhaps that men don't want to ask questions about. And that's what we're here for. Remember that Health Sense on 1FM 91.3 with Glenn and the Flying Dutchman is supported by Glen Eagles Hospital, Singapore, on your side. To begin our show this time round, we have a urologist from Glen Eagles Hospital, Singapore, Dr. Colin Teo, who is also president of the Society for Men's Health. Thank you very much for joining us, Dr. Teo.
Welcome, Dr. Teo.
Thank you.
So, the prostate gland, it weighs 25 grams, it's about the size of a walnut.
How do you know that? 25 grams?
I know my stuff, I've been prepared. My producers told me.
Is it true?
Is it true it's about 25 grams?
Well, for a young man in the 20s, it's about 10, 12 grams. When you hit 50s, it's about 20, 25.
There you go.
Yeah, by definition, once it's above 20, it's considered enlarged.
Okay, whoops. Okay, but it does play a very important role, right? I mean, it produces seminal fluids to keep sperm alive. In some men, the cells in the glands produce semen in the prostate gland, and that can grow uncontrollably. Am I correct?
You are right. So men at 50, we used to have a saying, just to memorize for exams, at 50 years old, 50% of men will have prostate problems, and it is essential for reproduction. And other than that, it helps with some continence in men. So when it grows uncontrollably, it blocks urination, it gives discomfort, and it is associated with some sexual dysfunction. Therein lies potentially some taboo. But basically, when you know what's happening, you can get things all sorted out.
Okay, so let's talk about the Movember movement, which has become really huge. Why is this movement so important to men?
Well, I remember I was a registrar, surgical trainee in 2003. So that's where robotic surgery just came to Singapore. I was still assisting the surgeon when we started surgery. There was, because of this introduction of the robot, prostate cancer has been around all along, and in Caucasians, in Afro-Americans, they can be very aggressive disease, but by and large, for Asians, it's still not that bad. When we find that there's no way, unlike breast examination, unlike injuries, you cannot detect prostate cancer. But what's common is the non-cancerous prostate enlargement gives lots of urination problem. So when that came, when we did a survey, we asked, do you know what's your prostate for men? We're all clueless. But we asked, what about breast and cervical cancer? Men know everything. So men just don't know anything about themselves. So this Movember came up to highlight the problems for men, and they are prostate cancer, testicular cancer, and the truth is men do have higher cardiovascular diseases. All cancers, men have it higher, and in terms of sports injury, men have it higher. So men does have certain risk-taking behaviors, sense of immortality that drives us into problems, and so drive ladies up the wall. So that's why Movember started, and since then, I think it's brought lots of education and early awareness to men to actually get earlier treatment, meaning to say higher rates of cure and avoidance of more problems. So that's what happened.
You're talking about earlier and earlier. When should a man start to check his prostate?
Right, so it's very common to get like health screening, insurance panel, job screenings. They usually don't include tumor markers, but when it comes to men, we talk about testing for the blood PSA level, which is prostate-specific antigen, PSA for short. Okay. Not the harbor, not the shipping, PSA is a blood test.
Right.
And it's done simply, just a simple blood test without fasting required. And we recommend that for men at 50 years old, you should get it done once. If you have higher risk factor for prostate cancer, meaning to say you have family history, your brother, your father, your uncle have prostate cancer, or you're Afro-American by race, then you should start at 45, and about every 1 year or every 2 years, a test of that level is probably adequate to screen you for early prostate cancer.
Now, you've talked about urinary problems, you've talked about sexual problems. Are there any other warning signs that a man should look for? I mean, let's be honest about it.
Well, the reality is urination problems tend to hit most men. Well, erectile dysfunction, sometimes there's some association with prostate problems per se. Once in a while, it does frighten men. You can get blood in the semen, so that warrants a check. And the truth is, most of the prostate cancer are silent. When you get the actual sign from prostate cancer, usually it's late. It means it's spread to the bones and you get bone pains, you get unexplained fractures that shouldn't fracture in a normal bone. So those are late signs that prostate cancer is advanced.
I see.
Wow, it affects your bones.
Well, you noticed you had 5 questions that you asked.
I know, just Bobo. I'm going to leave it. I'm going to leave it to you now.
I've got a question. I've got a question for you, Dr. Teo. How can us men take care of our prostates?
Well, the motherhood statements are all right, all correct. Sleep well, eat healthily, more fresh leafy vegetables, avoid fatty foods. All this sounds very like, everybody knows that. Research and science have shown that more and more the pathways that food can affect cancers or boost your immunity against cancer is getting stronger. So for example, what are the food I should take to avoid prostate cancer? You tell me to eat vegetables, to exercise, I do all that. What else? Well, we know that things like pomegranate, foods high in polyphenols are good. So pomegranate, green tea, even broccoli, those are popular stuff that people take. Tomatoes, lycopenes. So we do encourage that, not excessively per se, but we do encourage such things. But basically a healthy diet, healthy lifestyle, that's pretty much what we can ask a man to do. And that's saying a lot because most people can't do it.
Right.
That is true.
Have you guys ever done a test like carnivores versus herbivores?
Well, so far I think it's difficult to establish that, but there are many food studies, so it's very hard to actually ascertain vegetarians per se itself versus omnivores that eat everything. So we can't really get down to actual head-to-head study. When it comes to food, it's hard to commit people of population towards such studies, but certain mechanisms have been studied, so numbers have been seen to actually drop in terms of PSA level rise when you take certain foods. So those have been done.
Right.
So other than the PSA test, as you mentioned earlier, which is a simple blood test, how else can I get diagnosed if I have a prostate or prostate cancer, for example?
So the PSA doesn't confirm prostate cancer. It suggests that your prostate is not healthy and your prostate cancer risk may be elevated. So anything above 4, you have a higher risk of like 20% chance of getting a positive biopsy. To confirm prostate cancer, we need actual tissue biopsy. We need to see the cells that confirms cancer. In the past, once you see a PSA of above 4, we would already recommend biopsy. But now, we are beginning to use more MRI scans to actually study the prostate so that even if we biopsy, if we see a prostate, a potentially suspicious tumor, we will not miss it in our biopsy. We can actually target it properly. But even if the MRI doesn't show any suspicious lesion, we can still get about 20% of positive cancers. So that has been introduced, and now we have amazing progress in imaging. There is ability to use ultrasound fused with the MRI picture that has been taken, and that allows us live targeting of the areas that we are concerned with. And that actually has allowed me at least to pick up a few patients who've been biopsied for years, and finally when we use this technology, we picked up the cancer. So that is a real difference. Otherwise, it's quite stressful to have a high PSA, multiple biopsies, no cancer found, and then every year you hear that, and yet you're being offered biopsy. So it has come a long way in terms of relieving and getting accurate diagnosis for people. Yeah.
Interesting.
I've heard about robotic surgery. Can you tell us more about that?
Well, first of all, we like to say that robotic surgery in urology, it's not the robot operating, it's still us. What happens is we are on a console, we are able to translate wrist and finger and hand movements into the body, and all this is done through keyhole surgery. So you don't get big scars, you get a few small holes, and then we're able to get a very magnified 3D picture of what we're dealing with, and we can do stitching, reconstructive work, dissection at the level and precision that we couldn't do previously. before robot came about, we were doing laparoscopic surgery. Pretty much how I describe that is like trying to build the little boat in a bottle with a stick. That's what we were doing previously.
Okay.
Now we could do it. I mean, with training, we could all do it. But with the robot, we can do amazing things. It's almost like building a drone around the ship in a bottle instead. So that's something that has come a long way. And robots have been improving in terms of technology. And there's some new robots coming on board. But pretty much the same robot has allowed us to convert what was technically a very difficult surgery, which is prostate surgery, to something that a person can go back after 2 days rather than a week. And they are pretty much painless after surgery.
Right.
They hardly take painkillers. And that's brought a lot of lower complications, lower morbidities of pain to patients, and they're a bit better off. But of course, who are we kidding, right? It's still surgery, it's still major surgery.
But I was about to say that. I'm sure the success rate has just, been raised as a result of robotic surgery.
Yeah, you're right. It allows us to employ techniques like nerve sparing that we could do very carefully. And preserving nerves is important for sexual function, for continence, and we are able to do micro dissection or very refined dissection of what we call the bladder neck, which is important to maintaining continence after surgery.
Okay.
So without having to say anything else, but a lot of famous people are known to have prostate cancers. They had robotic surgery, and you look at all of them, it tells you one thing: prostate cancer picked up early doesn't kill, because they all look normal and functioning well. Second is, they are functioning well, meaning to say the surgery did not take them out of action and everyone's still running around. So I think that's as good a situation as we can get in a cancer patient.
You've brought a video with you that explains
yes.
this surgery a bit.
Yes.
Shall we watch that video, and can you explain what's going on?
Oh yeah, so yes, I was told no graphic pictures with blood. So we got a very nicely done video. It's available everywhere. And what we're showing is basically the grape. We all eat grapes, right? All emperors eat grapes. And sometimes for very refined people, we peel the skin. And we find that peeling the skin is that difficult. Now, the truth is, for prostate surgery, the capsule, which is the skin, there you see it. The skin is like the capsule of the prostate. In fact, that's where the nerves run.
Okay.
For erectile function. Right. That's where, to spare the prostate, we can just peel it off nicely. And once we peel it off, when we have to reconstruct everything back, you can find that the robot allows you to stitch with a very fine stitch.
My goodness,
for a very fine skin.
It's amazing.
It's a very expensive way to eat grapes, but remembering it's for surgery, that is how refined things are.
Wow.
Your hands will not have any shakes. You have the power of the motorized wrist to put your stitch precisely where you want, and you can get very good angles that you can't get when you do just the standard laparoscopic surgery. So this is where we say technology has really brought the standard of care for men, and I think that's where I think it's a great thing that we are pursuing technology. Medical science is still pushing ahead, because now, while we have a few holes for the standard robot, coming in the future, already available in some parts of the world, you have a single port robot that through one hole, you literally can do what you need to do. Having said that, robotic surgery has also extended across to colorectal surgery, hepatobiliary surgery, anything in the tummy, even the ENT in confined space. A robot allows you to just use a minor wrist action to do stuff. So we're excited. It's been around for many years. And like I said, the idea of surgery is always something horrifying, big scars, and slow recovery. So the robot has really made some difference. But again, it's not the robot that did it automatically.
It is the surgeon.
Yeah.
It's the surgeon at the end of the day.
And the truth is, the key is really not everybody should be getting surgery. The very early prostate cancers, you can watch them for a while before jumping in. The very advanced one, then, well, we have to personalize care to the patient. So it doesn't mean that everybody jumps on the surgery bandwagon, but that's where, the best results are always how we select our patients.
Right. Now, that was just mind-blowing.
That was incredible.
How small is the grape, right?
Yeah.
And to peel the skin off and then stitch it back on the grape, I was looking at that, and there were at least 12 stitches to stitch that small piece of skin back on the grape. And it was absolutely perfect.
Yeah.
It's crazy.
That's absolutely crazy.
Wow.
Just very quickly, could you tell us a little bit about BPH?
Oh, well, yeah. So while we talk all about prostate cancer, the majority of men have a benign enlargement of the prostate, which is BPH. And for that, well, we would say that out of 100 men, 50 of them will not need medicine. They just have to adjust their fluid intake, and they can control their prostate enlargement, which causes nocturia, which is waking up at night to pass urine, which can drive you nuts.
Yeah.
Having slow flow and having a prolonged time when you pass urine. So you go on a tour bus, everyone's waiting for you, you're going to start traveling, and it has impacted people, not from a danger sense, but socially. And when it's bad, you can start leaking urine, you can't control, you can't get to the toilet in time. So 50% of men just have to adjust what they take, avoid diuretics, which like coffee, tea makes you urgently. 30% actually, medicine would be enough, but you take medicine for life. So prostate enlargement is a chronic disease that is diagnosed as one that is chronic, not acute. And 20% of men, no matter what you do, is going to keep enlarging. Then we do surgery. But surgery, already for cancer, is robotics. But for benign prostatic hyperplasia, it's what we call natural orifice endoscopic surgery, where we go through your urethra, shudder at the thought, but you won't feel anything. You're under anesthesia. Yeah. So we go in there, we shave the prostate, open the blockage, you're back home in 1-2 days. For those who are not fit for surgery, the latest thing that came in about 6 months ago was this thing called a ProLift instrument, a gadget technology, where we insert a catheter into a patient. If he's not fit for anesthesia, he's awake. So we put it in, 45 minutes, it uses thermodilation, microwave energy to just coagulate or kill the gland. We take it out, you go home the same day. It may not do the great work like surgery, but it's enough to buy you many years. You may not need medicine after that.
So it's day surgery?
It's day surgery.
Wow. That is quite amazing.
Yeah.
Right.
That is truly quite amazing. Dr. Teo, thank you so much for being with us. It's been so enlightening. It's been a pleasure speaking to you.
My pleasure. Thank you for inviting me. Thank you.
Good times. Greatest hits. 1FM 91.3.